Medicines, as defined by experts, are preparations for the treatment or prevention of diseases. As useful as medicines are to the well-being of people, experts say medicines can become poisonous to the human body and begin to do the exact opposite of what they are meant to do when wrongly combined for use, when not properly stored.
You can't buy paracetamol and just go. You buy the paracetamol and the pharmacist advises you on how to use your paracetamol. For example, if you are supposed to use this product for 5 days, use it for 10 days, you've converted it to poison. Because in determining that 5 days is the optimum dose, we have looked at what we call clearance time, renal clearance. We have looked at the metabolic routes. Is it metabolized in the liver? So if something that you're supposed to use 10 items into your liver, you use 20, you have overloaded the liver. And the liver is the chemical is the chemical warehouse, is the chemical factory. Because if not for the liver, this drug that is poison will remain in your system as poison. So immediately it does this therapeutic work, it goes into the liver. Liver converts it into things that are less toxic to the body, and then it goes into the urinary to your kidney. The kidney now extracts the poison and you urinate it. The alimentary system takes the one that goes through the stool, you remove. So they maintain body system. But like anything else, if you overload it, it will become more sluggish in clearance, and sometimes can be overwhelmed, because the liver itself is even though it's detoxification, we call it detoxification, is changing something that is toxic to non-toxic. But that thing that is toxic is trying to change, can poison it, the liver itself. So you have liver necrosis. You have people who take too much of alcohol, they develop liver problem. Alcohol is medicine. So a drug can become poisonous if it is taken in the wrong dose. If you are supposed to take 10 kilograms or 5 kilograms and you take 100 kilograms, you are poisoning yourself. If you are supposed to take 5 days, I'm not talking about quantity, 1 milligram, 10 milligram, 2 milligram, 15 milligram. Do you know that the milligram you take is as if it will not just say take 2 milligram. It's related to your body mass. What's your height? What's your weight? What's your age? That determines the quantity we'll give you at a time. Then the duration. How long are you supposed to take it? So if you take it longer than you are supposed to take it, you are causing yourself trouble. Thirdly, if you take it in the wrong condition. For example, there are certain drugs you are supposed to take on empty stomach. There are those you should not take on empty stomach. If you take some drug you're supposed to take on full stomach and empty stomach, it becomes a poison. Because rather than go to heal you, it starts causing you. I give you an example, aspirin. If you take aspirin on an empty stomach, it will start eroding the walls of your stomach and cause ulceration. Or you take overdose, it can lead to ulceration. So frequency, duration, what should you take your medicine with? If you take oxytetracycline at the same time as you take an iron preparation, at the same time, you will not even get any action, because neither the oxytetracycline nor the iron tablets will be absorbed. They will form a complex that will just pass through your stool. These things are not known by all people who sell medicines or who can mix one medicine or the other. So Nigerians, stop risking their lives. Go to the pharmacist who knows, who understands these things, and you take the medicine and it will give you the therapeutic benefit. The